Hey everyone, welcome back to Medical Tips, your go-to spot for simple, trusted health advice. I'm Dr. Mike, and today I'm sharing something that could surprise you. Let's dive in.
Mpox explained symptoms, spread, and how to stay safe. You might have seen the word Mpox popping up in news headlines or on social media. It sounds unfamiliar, maybe even a little alarming, and that's understandable. Mpox is not a new virus, but recent outbreaks outside of its usual regions have made it a global concern. So, what exactly is Mpox? How serious is it? And what can you do to stay safe? In this video, we'll break it all down clearly, calmly, and factually, so you understand the basics without the fear. Mpox, spelled Mpox, is a viral disease caused by the Monkeypox virus, part of the same family as smallpox. Despite the name, it's not just a monkey disease. The virus was first discovered in monkeys in a lab in 1958, but it's believed to be carried by small animals like rodents in the wild. The first human case was identified in 1970 in the Democratic Republic of Congo. Since then, it's mostly been seen in parts of Central and West Africa. However, in 2022, Mpox cases began showing up in countries where the virus hadn't been found before, including the United States, the United Kingdom, and across Europe, Asia, and Latin America. That sudden, unexpected spread raised red flags for public health officials worldwide. Mpox typically begins with flu-like symptoms. These can include fever, chills, headache, muscle aches, and exhaustion. One of the most telling early signs is swollen lymph nodes, a symptom not seen in diseases like chickenpox or measles. After a few days, a rash usually appears. It often starts on the face or around the genitals and spreads to other parts of the body. The rash goes through several stages, from flat red spots to raised bumps to fluid-filled blisters and then to scabs. The whole illness usually lasts 2 to 4 weeks. For most people, symptoms are uncomfortable but manageable, and they recover without treatment. However, people with weakened immune systems, children, or those with other health conditions may face a higher risk of complications. Mpox spreads through close, often prolonged contact. This includes skin-to-skin contact, kissing, or sharing items like bedding, towels, or clothing with an infected person. It can also spread through respiratory droplets during face-to-face interactions, although it's not considered airborne like COVID-19. In the 2022 outbreak, a significant number of cases were linked to intimate or sexual contact. However, Mpox is not classified as a sexually transmitted infection. It can affect anyone, regardless of sexual orientation or gender. That said, outbreaks often begin in close communities, which is why early education and prevention are so important. If you develop symptoms, especially a new rash or flu-like illness, and you think you may have been exposed, you should speak with a healthcare provider. Doctors typically diagnose Mpox by taking a swab from a lesion, meaning one of the rash bumps, and sending it for a lab test, usually a PCR test. This is the most accurate way to confirm if someone has the virus. Early diagnosis helps prevent further spread and gives people the right support while they recover. So, how can you protect yourself? First, avoid close or intimate contact with people who are showing symptoms, especially if they have a rash. Don't share personal items like towels or clothing. Wash your hands frequently with soap and water or use hand sanitizer. There's also a vaccine available. It's called Jynneos, originally developed for smallpox, and it's been shown to offer protection against Mpox. It's typically given to people who are at high risk, like healthcare workers, lab researchers, or those who've had close contact with someone infected. While there's no specific cure, most cases resolve on their own. In severe situations, antiviral medications like tecovirimat, also known as TPOXX, may be prescribed. You might be wondering, if it's not spreading rapidly like COVID, why does Mpox matter? Well, Mpox reminds us that infectious diseases can emerge or reappear at any time, especially in our interconnected world. Travel, trade, and climate change all play roles in how diseases spread, and when a virus jumps from animals to humans, like Mpox did, it becomes a global concern. Even though cases are declining in many places, awareness and prevention are still key. When we understand how a disease works, we're better equipped to stop its spread and protect those most at risk. So to recap, Mpox is a viral illness with flu-like symptoms and a rash. It spreads through close contact, usually resolves in a few weeks, and can be prevented with good hygiene, vaccines, and informed choices. Knowledge is your first defense, and now you've got it. If this video helped you understand Mpox a little better, give it a like, subscribe to the channel, and consider sharing it with someone else who might benefit. Stay safe, stay informed.